There's a revolution going on, and no one really can deny it. And that revolution is part of this, we're calling the inflection point. So our agenda is going to focus in on those 6 drivers, and that is internet, social media, and AdWords, which is your visibility on the internet, planned and funded marketing, how you pay for these things, patient retention, still your #1 referral source, online reputation, important because it makes or breaks a day or a week in your month if it doesn't work the way it's supposed to work, internet telemedicine, and social media visibility. Let's look at the next one, telemedicine. Well, I'm not so sure I like that word telemedicine because it's really much more than that. It's telecommunications probably is a better handle for that. Now, there are 2 types of telemedicine, telecommunications that you can have with a patient. You can have a non-doctor-patient relation type of communication. It might be a consultation over the phone. It might be a communications program where you're answering questions that have been generated from an e-blast that was sent to patients that called your office but never came in to see you. Or it could be, in fact, an actual patient-doctor relationship. It could be a way of making your office even more efficient and more effective. You could have a post-operative visit done over the phone, and this is being done, by the way. You could have a paid consultation done over the phone. We think it's going to do these things you see over here on the left-hand side. It's going to improve your practice access and your service delivery efficiency. It's going to give you some cachet. You're going to look like you're on your job. You're on your game. Now, you could say, well, don't want to do that. Well, if you don't do that, the negative part is that those patients that are looking for that are going to find other practices that do offer that. So there's going to be lost opportunities. What's the quotient? How do you know that this is working or not working? How do you know if it was worthwhile doing? Well, if you've done it, you're going to discover that there's some new income opportunities that will expand the income that you currently have, a new income source that will make more money for you. Okay, what's our checklist? What is it that you have to do now? Well, 1, you need to have the technology. You need to have the technology that you can have a Skype type of relationship over the phone. And that's what all of this is all about. It's a voice and video connection, and you see it every night as you watch the news, as the news is now reported. They aren't flying these experts in anymore to reinforce their stories. They're talking to them over some type of a telecommunications process. You want to be sure that if it's a doctor-patient relationship, that you are compliant with any HIPAA issues. And by the way, we have staff now working on telemedicine communication systems that we're setting up to go live in January, February of next year. And we are very aggressive about this, and we think this is a game changer. Now, there are some federal laws, regulations that are being formed today that frankly are more supportive of telemedicine, But there are some parts of some of the state and local regulations that would perhaps give you pause and would maybe want to consult and make sure that you're not being out of compliance with whatever those requirements are. There are documentation issues. Do you include this in the medical records? What part of the actual encounter is included? Is it an audio? Is it a video? Is it snapshots, pictures? There are issues that we need to deal with. And then there's issues of the patient and the clinician's rights and responsibilities, your staff. You know, what can they do? What can they not do? What liabilities do they present or not present? I think you'll find this to be an area that does require further investigation, but it's not an area that you're going to simply put on recheck. It's something you want to embrace. Very much encourage you to call me today, call me in the future. I'll be more than happy. You see a picture, little icon of some of our staff members over here that are here to serve you and help you, and we would love to hear from you.